Hello, everyone. I'm part of a team that has worked on palliative care discussion detection as part of Google Gemini long context competition. And in this presentation, I just want to walk you briefly on the importance of working on this project itself, and specifically why we think that Gemini is very useful for these kind of problems. Palliative care, of course, is a critical component of healthcare, particularly for patients that are experiencing chronic or terminal illnesses, unfortunately. It focuses on improving the quality of life for patients by addressing their physical, even emotional and psychological needs, and it also provides support to their families. A key aspect of palliative care is the ongoing discussions that happen between healthcare providers and patients, in which care goals, treatment options, and of-life preferences, they're all explored. However, capturing and analyzing these palliative care discussions is a very challenging task, especially when they are embedded within clinical notes, which often contain vast amount of unstructured information. The current methods for detecting palliative care discussions often incorporate rule-based systems, which rely heavily on searching for specific keywords or phrases, or use natural language processing techniques, which are great. They go beyond simple keyword search, but they require a vast amount of training data that are annotated by humans. Unlike generative AI models like Gemini, which are capable of understanding the context of the entire conversation, these NLP models are often also constrained by the input token size and training data, and they may miss implicit or indirect mentions of palliative care discussions. This highlights the need for more advanced, more context-aware models that can comprehensively analyze and interpret very long and comprehensive clinical notes to better detect and understand palliative care discussions. The long context window of Gemini allows us to address limitations we might have with some of the other LLMs and NLP models in place as well for such natural language processing tasks. Because for majority of LLMs out there, we have input size token limitation. But as you can imagine, clinical notes can get longer and longer as the patient stays more in the hospital or the patient experiences complex situation, which is generally the case for patients that require palliative care discussions. So if we can build something simple and cost-effective that we can easily scale and integrate with our medical workflows, healthcare workflows, we need to utilize models such as Gemini, for which we don't require to find workarounds such as chunking, retrieval augmented generation, or suboptimal methods in which we need to just process a subset of clinical notes. With Gemini, we actually can process the whole node at once because it doesn't have that input size token limitations as other models. For the sake of this competition, we worked on two tasks. The first task is a synthetic data generation, and the second task is actually the main task of this notebook, which is detecting palliative care discussion. We decided to utilize Gemini to generate synthetic data sets for this competition because, as you can imagine, real-world clinical notes often contain sensitive patient information. It's not easy for us to access and use them for research and model development due to privacy and ethical considerations. But having access to realistic synthetic data really enables us to be able to do a lot of modeling and stress testing, performance of the prompts we develop. And that's why we decided to use Gemini specifically for this synthetic data generation, which is currently available on Kaggle as well. The way we go about generating synthetic data is kind of shown in this workflow diagram on the right. We first utilize Gemini and a note generation prompt, given it a sample patient information like their gender, age, the disease they're experiencing, the stage of the disease, whether we want that note to have some palliative care discussion or not. And then we generate the first portion of the note, given the output token limitation of Gemini and many other LLMs. And then in a parallelized loop, we keep extending this portion of note by passing the node generation till this point and a node extension prompt to Gemini. We repeat this extension until we generate some realistic long context clinical note, which generally contains somewhat more than 120,000 tokens. When this synthetic data is generation, now we are going to go to the next step, which is detecting the presence of palliative care discussion. Now, all the sample synthetic data generated one by one, they're going to go through Gemini model with a detection prompt, and the idea is to predict yes or no, whether the palliative care discussion is detected by the model in the note or not. This seems to be a very simple task, but as you can imagine, the long context of the clinical note and the structure of the note, all this variation of discussions in the note can make it really hard for the model to identify palliative care discussions. Even so, we still can see that with few experiments, we can come up with a prompt that can achieve a pretty high specificity of 0.97 and a good precision of 0.83 and good accuracy of 0.83 as well. Although we observe a pretty low recall, but in general, for palliative care discussion detection, our main focus is to minimize false positives. We want to make sure if we say that the node doesn't exist, doesn't contain palliative care discussion, it really doesn't contain the palliative care discussion. That's why for our prompt development and our initial experiments, we decide to focus more on precision rather than recall.